I'll be presenting the case of Arun Patel. He's one of our shadow health patients. Mr. Patel arrived at the clinic today with a chief complaint on checking up on some of his numbers that he has for his diabetes and hypertension. History of present illness. Mr. Patel is a 38-year-old Indian American who presents to the clinic today for a recheck on some of his numbers for his type 2 diabetes and hypertension. He has reported a 15-pound weight gain, increased fatigue, and feelings of being uncomfortable over the last 3 months. He reports new onset polyuria and polydipsia for the past 1 month. Patient reports an increase in consumption of takeout foods due to the lack of time and energy. Denies utilizing any exercise regimen or adherence to a heart-healthy or diabetic diet. He lives a sedentary lifestyle and does not engage in much physical activity. Mr. Patel is in graduate school for film. His parents are not supportive. Mr. Patel reports that his girlfriend is his primary support system, but he does not want to stress her out with his stressors. Mr. Patel has a 5-year history of type 2 diabetes, which he takes metformin 850 milligrams TID. Patient does not check his blood sugars regularly because he is not fond of the finger stick glucoses. He also is positive for a 1-year history of hypertension. Currently, his hypertension is being treated with hydrochlorothiazide 50 milligrams once daily. He does not monitor his blood pressures at home regularly. He also has a 15-year history of generalized anxiety disorder, for which he takes Lexapro. Mr. Patel denies any side effects from his medication regimen and reports that he rarely misses doses. He also denies the use of alcohol or other drugs. Past medical history is positive for hypertension, diabetes, type 2, and anxiety disorder. His current medications are mentioned above: metformin 850 milligrams TID, hydrochlorothiazide 50 milligrams once daily, and Lexapro 20 milligrams once daily. His past surgical history is non-significant. Family history is positive for a father with anxiety and hypertension and a mother with type 2 diabetes and hyperlipidemia. His social history, he reports his girlfriend is his primary source of support. He does have friends in film school. He has no support from his family, denies alcohol, tobacco, or other drug use. Review of systems. General, he's positive for fatigue, a 15-pound weight gain in 3 months, positive for polydipsia, denies fever, chills, night sweats, or weakness. His skin is no rashes, lumps, or hair and nail changes. Head, ears, nose, and throat, denies headaches, hearing loss, vision, congestion, sore throat, or vocal cord changes. Respiratory, he's negative for a cough, wheeze, shortness of breath, or chest pain. He reports no difficulty breathing. His cardiovascular assessment, he denies chest pain, denies racing heart, chest tightness, or palpitations, but he does have a history of hypertension. GI, denies nausea, vomiting, change in bowel habits, or difficulty swallowing. He is positive for an appetite diet change. He's reporting more use of takeout foods and positive for weight gain in 3 months. GU, he denies hesitancy or incontinence, but he's positive for polyuria. Neuromuscular, denies headaches, dizziness, fainting, back pain, joint or muscle pain, or any recent musculoskeletal injury. Psychiatric history, he's positive for anxiety and stress. He denies suicidal thoughts or ideations. His endocrine system, positive for polyuria, polydipsia, and type 2 diabetes. Objective. Mr. Patel is generally well-developed, slightly obese Indian American male. He appears alert and oriented and in no acute distress. He is dressed appropriately for the weather and is well-groomed. He is seated upright on the exam table and maintains eye contact throughout the interview. His current vital signs are as followed. Temperature, 37 degrees Celsius. Blood pressure, hypertensive at 146 over 94 millimeters of mercury. His heart rate is 75 beats per minute and regular. His oxygen saturation is 98% on room air. Most recent labs. Currently, hemoglobin A1C is 9.3% with a blood glucose random fasting of 210. 6 months ago, his A1C was 7.5% with a random blood glucose of 142. His blood pressure readings at home consistently over the last 4 weeks have been noted to be above 140s over 90s. Assessment. Mr. Patel is a 38-year-old Indian American with hypertension, type 2 diabetes, and presents to the clinic today for a checkup. He has not been regularly measuring his blood pressures or obtaining blood glucoses at home. He is under financial and emotional stressors which have contributed to his current health condition. He is positive for a 15-pound weight gain in the last 3 months. Plan. I prescribed Mr. Patel a combination pill for lisinopril hydrochlorothiazide 10 milligrams to 12.5 milligrams once daily to treat his hypertension. I've also prescribed a combination medication, glipramide, metformin, 2.5 milligrams to 500 milligrams to be taken twice daily with meals to treat his type 2 diabetes. I have recommended that he start monitoring his blood glucoses and blood pressures daily and keep a log at home to track his trends in blood sugars as well as blood pressures. I educated Mr. Patel that it is important to maintain his healthy blood glucoses and to keep track of the logs, as if he were to continue to develop further diabetic complications, he may require insulin, which will involve having a shot every time instead of just the finger glue sticks. I would recommend Mr. Patel make an appointment with a dietitian to review heart-healthy and diabetic-friendly menu options and encourage the use of an exercise regimen and utilize a stress management technique tailored to the patient's success. I would like to see Mr. Patel back in my office 3 months from now for a checkup, review and of the daily blood sugar and blood pressure logs, and then repeat follow-up labs to assess the effectiveness of this treatment plan.